Okay. Good afternoon. Good afternoon. Good afternoon. Just going to give it a couple of minutes so everyone gets the notification that I'm live. Okay. Okay. Good afternoon, everyone. Thank you. Thanks for joining. We're just going to wait for a couple of minutes for everyone to join us. We're talking ovarian cysts and how does this affect my fertility. Nina Lombard. Thanks for joining, Nina. You have been on every one of our talks. Shireen, been on every one of our talks. Thank you, Shireen. Thanks, guys, for all the support today. I really appreciate it. And it's so amazing when women are supporting each other. If any of you guys on here are in the Cape Town region, please remember I spoke about the little get-together that we're going to be having. No cost at all, just to help you guys. It's going to be based at one of the clinics. My thing is going a bit funny, weird. Okay, so we are just going to wait for Doc to join us now. It's Dr. Moloi. He's from the Joburg Fertility Clinic, and we're going to talk about ovarian cyst and how does this affect my fertility. So hi there. Thank you so much for joining. We're just going to wait for Dr. Malloy to come online. So we've had a few people that has gotten the giveaways. Davinia, thank you. You've also been on every one of it. And we really appreciate it. So if you're from Cape Town, please let me know. Just watch out. I'll put up would love to join in Cape Town. Awesome. Like I said, it's going to be held at one of the fertility clinics here, free of charge, one evening in the week. Just a support group to help the women. When women are going through infertility and they join a support group, it actually helps. It actually helps you, and that has been one of the doctors actually said that a couple of weeks ago in one of the talks that I had. And that's made me think I have to start a support group for these women. So we are talking about ovarian cysts and how does it affect my fertility. And our next, just to let you know, our next winner will be okay, so we're doing the prize of another myofolate, and then at 6 o'clock we're going to be giving away 3 prizes from Genesis Fertility Clinic. 3 prizes from Genesis from 3 different, each doctor is giving away. So that's a big prize, guys. You got to join. So if you're in the Joburg region, also let me know that you're in Johannesburg. I think it's Pretoria, Johannesburg. Yeah, so if you are there, I think Joburg is gone, they online. But if you're in those regions, let me know, because you could be a winner of that prize, and that's an awesome prize. So Joburg, I'm waiting for your request. Otherwise, let me try and send you a quick. Had so many talks with Dr. Moloi. It's a great doctor from Joburg Fertility. There we go. Hi, Dr. Moloi. How are you?
Hi, I'm okay. And you?
Good, thank you. Lovely for you to join
Great.
us. I'm so glad
Yeah.
when you can join us on these talks. So Dr. Malloy is a fertility specialist at the Joburg Fertility Center, Joburg Fertility Clinic. Dr. Malloy, if you could please give us just a little background on where you are and what you do. Give the ladies some details.
Yeah. Joburg Fertility, it's we actually situated in Johannesburg in a place called Four Ways. And we actually do mostly IVF treatment and even endoscopic treatment. Therefore, we've seen that covering most of our patients, those with fibroids, and so we do a procedure which we call conservative surgery to help them to be pregnant. And
Yes.
a topic of today is also actually a very important topic and one of my passion of ovarian cyst, which is a very common problem. And I would really looking forward so that you can discuss it in detail. Again, I can actually explain to you guys in detail how it should be managed.
Yes, I actually on purposely chose this topic for you because I know this is something you deal with a lot, and that's why I actually chose this one for you. So first of all, what are ovarian cysts?
Yes. Yeah. Ovarian cyst is basically a fluid collection which you found in the ovaries. Fine. Then when you do an ultrasound or do a scan or you do even examination, sometimes you can feel them. It's just collection of fluid. But now, really, I would like us to understand ovarian cyst from two angles. The first one, ovarian cyst can be physiological or functional. In other words, they do no harm. It's just a menstrual cycle part of any woman. Therefore, every woman do develop ovarian cyst during a menstrual cycle. Therefore, what happened, the ovary to release an egg, it expand and you grow what you call a follicular cyst. And that follicular cyst, an egg inside, then you get to and ovulation and that egg is expelled. Therefore, that's a functional ovarian cyst. It is not harmful. It's natural for you to be pregnant. Therefore, it's your friend, or it's everything what a woman goes through on a monthly basis. Then there's a second part which we say probably those cysts can be abnormal, or we call it non-functional cyst. Those are the one we also will talk about as well. And also there are cysts or follicles which somebody will have when he is going through an IVF cycle. Therefore, that is also a functional cyst in a sense, in that in those cysts we get the eggs, and those eggs are the one which will get you pregnant. Therefore, we give you stimulation medication, and it will develop those follicles which are are really cysts, and then we aspirate them and we get the eggs, and you can be pregnant from there. Now, the non-functional cyst, which I would like us to think about, the common one, it will be something like a cyst adenoma, which is a benign growth. Because it's got really a solid part and a fluid part in it, therefore it tend, to be scary, and the doctor will come in and then try to remove it. And it's very important that a conservative surgery is also, actually done in those patients, so that you don't just remove all the ovary. At the end of the day, the patient's got a problem that, he cannot get pregnant because the whole ovary has been removed. Then the other important one is also a cyst due to endometriosis. And this cyst, we call it endometrioma. In other words, what happened, the physiology behind the whole thing, the endometriosis tissue stuck on the ovary, and the ovary go around and, surround this, trying to, prevent it to, do any harm. But the endometriosis keep on growing, and then that causes endometrioma. And however, it can compromise the egg of the ovary, and then it can cause somebody to have a low MH, or egg count. In that way, it also need an operation, and the operation is very delicate as well. That's where conservative surgery come to play, because you really need to identify only the endometriosis and remove the endometriosis and leave the healthy ovary alone. But most, surgical, especially people who open and do laparotomy, they'll end up removing the whole ovary, which is not really a good approach. Then the other common non-functional, it will be something like what we call a Demode's cyst. Now, what is a Demode's cyst is really one of the tricky part, or very interesting part of a human being, because we know the ovary really is the origin of human being. The ovary basically just needs sperm, and the sperm doesn't contribute much to, end up with a human being. It's just, trigger certain enzyme and so forth, or mechanism to get to a human being. But the ovary can produce teeth on itself, can produce hair, can produce, glands and so forth. Therefore, that we call the Demode's cyst. Also, it's very important, if that has been done, that the operation is done conservatively, because you find this ovarian cyst in young women who actually probably in a year or two, or even during that time, planning to get pregnant. And then this management of the Demode's cyst is removing the whole ovary. Therefore, also a conservative surgery, remove the part which is dermoid and leave some part of the ovary which can be used for fertility reason in the future. Now, going back to the normal ovarian, remember, or the functional one, we've got a corpus luteum, which you can have probably when you're pregnant, which can also maintain the pregnancy, which also sign that you have ovulated as well. Then a hemorrhagic cyst as well is another cyst which we have to be careful and know about it, because some people will look at it and then said, yo, let's go and remove the ovary because it's a lot of blood. But it's actually an ovary which actually have ovulated. It's just some clot remaining in an ovary. Really cleaning it and not interfering much with it, it will be a good approach rather than removing the whole ovary.
Okay. And then what causes ovarian cysts?
Yes. Then, as I said, the first part, the ovarian cyst, it's a normal physiological menstrual cycle that we call the corpus luteum, that we call a functional ovarian cyst, which led you to ovulate so they can be pregnant. Therefore, basically, it's a normal menstrual cycle. Then the others, which I talked about, the first I talked about the endometriosis, which is a cyst caused by the endometriosis. Therefore, it's pathological. It's actually abnormal because the ovary has been attacked by endometriosis. Then it's trying to confine the endometriosis in one area. Hence, you got what is called endometrioma. Then the other cyst adenoma and so forth, it's really a pathology in the sense that we've got a solid part where the ovary tend to give a solid part, which is really abnormal. And the last one I talked about is a dermoid cyst as well. It's actually where the ovary manufacture or developed into a tip, develop into something like a hair and something, which is what the ovary is capable of, but it's doing it at the wrong time. It's still in a human body, which is supposed to be done actually to be happening in a baby who is born.
Yes. Okay, so how are they diagnosed? How do you diagnose cysts?
Yes. Now, the cyst typically can present with symptoms. That's the first thing. Some of the cysts, there's one thing I actually have to mention here, which is very important. We usually look at certain things in the ovarian cyst, especially the functional one, and said, this probably need operation or not, or to manage. The size is very important. Any ovarian cyst more than 5 centimeters, it can cause a lot of problem. One, it can be pressure or pain. One, it can cause irregular menstruation. The other one, which is severe, most of us will be afraid of, is really a torsion, where somebody get a torsion and lose the whole ovary. Then in other words, can give you irregular menstruation. You can have pain on the left or right side. And then, in that case, an ultrasound is done, then the cyst is picked up, and then, then a proper treatment can be done after. But the most important is symptoms, which the cyst can give, irregular menstruation, or it can give you pain sometime, fine, which is, even in hormonal imbalance, irregular menstruation, or even heavy menstruation as well. And then an ultrasound is actually the most important investigation which can be done, which will diagnose the ovarian cyst, and it actually even give us some, understanding what type of ovarian cyst we are dealing with.
Okay, and then so what treatment plan do you recommend for someone suffering from ovarian cyst?
Yes. Now, it's very important that the patient should be looked in total, actually, and even the desire of the patient. Now, if the patient come with an ovarian cyst, which is really benign from all angles, in other words, it's just a fluid, and it's really between 3 and 5 centimeters. It doesn't cause really, there's a pain, very little, and probably even abnormal bleeding, and there is still a very young patient. I would say oral contraception in a patient who's not actually planning to be pregnant. Some oral contraception will really control the ovarian cyst and suppress it. And we know one of the benefits anyway of oral contraception is that they prevent people developing a lot of ovarian cyst or reduce the number which you can get. Therefore, that's somebody who's not planning to be pregnant at all. But then we know as well, you can as well have ovarian, you can have follicular cyst, which when you stimulate you, those one we are welcomed because you are in the process, either you've got fertility medication, oral, or got injection. That's very important. That will help you to get to pregnancy. We appreciate those. Now, if you have those, which I said, they're non-functional, like something like a dermoid cyst, cyst adenoma, endometriosis, surgical, intervention will be the best. Really, conservative surgery to conserve as much of the ovary as possible. And the other idea in most, I would say, do like something like AMH before, and then, before you do the procedure, then later, 3 months down the line, repeat so that you can check you didn't take or harm the ovarian tissue in that situation.
Okay, perfect. And then can I conceive with ovarian cysts?
Yes, it's possible to conceive with ovarian cyst, a certain size, if it doesn't, interfere with your cycle. We do have a lot of patients pregnant with ovarian cyst. It's very common, it can happen. But if it does interfere with hormones or your hormonal imbalance, then in that case, you'll probably need, surgery. Now, on top of my mind, when you ask whether can you be pregnant with ovarian cyst, then I'm thinking of polycystic ovarian syndrome. Yes, you can. If we stimulate you and one ovary ovulate, you can still have that a lot of cyst in the ovary with pregnancy going on, although there may be other complications related to the condition itself.
Okay, and then the last question for you, and you always have such beautiful words for the ladies after your talk, is what words of wisdom can you offer our ladies trying to conceive this World Fertility Day?
Yes, it's very important that if somebody is really trying to conceive and then he's got the diagnosis of ovarian cyst, it's very important that the management of that ovarian cyst be done probably by a fertility specialist who really will try to conserve or do a conservative surgery so that it doesn't interfere with fertility in the future. We really think that it is the best way rather than and the other important thing I would really, just for wisdom's sake, it's very important that the person who's doing the operation is actually have a good expert in doing that, because multiple operation itself or wrong operations or a lot of operation can cause adhesions and can make you be vulnerable to a lot of ovarian cysts as well. Therefore, it's very important that if you have ovarian cyst and you're planning to be pregnant, get a fertility specialist who will actually balance and do the right procedure so that you can, get to pregnancy with no problems.
Okay, perfect. Thank you very much, Dr. Moloi, for joining us today and taking the time out. And thank you for all the things that you do for the women and helping women trying to conceive, that is trying to have their dream of a family as well. Thanks, Doc, and have a great day
Thank you.
further.
I appreciate everything, and you guys keep up. Bye
Thanks
bye.
very much, Doc. Bye. See you guys
Bye.
later at 6 o'clock. Bye.
Bye.